We use the serum Freelite chain to diagnose multiple myeloma for patients that do not have a complete immunoglobulin secretion by the tumor cells, so what we call the so-called light chain multiple myeloma. And also for patients that would have no secretion in the serum, no secretion in the urine of complete immunoglobulins or Ben-Jones proteinuria, what we call light chain in the urine, then the test is very useful because in the past we would call those patients, we were used to call those patients non-secretory. We know now, in fact, they secrete serum Freelite chain in the serum and that you can catch those patients, diagnose those patients with this test. The most important part of the test is that we use that test in the context of monitoring to study the response of the patients, and especially when the electrophoresis get normalized in the serum and in the urine. For most of the patients, if you check the serum Freelite chain test concentration, you could see that the test remains positive, and at some point you have to monitor that test because that test is by far more sensitive than the electrophoresis in the serum and the urine. So we use that test in the context of patients that are very close to complete response where the other tests are not sensitive anymore. We initially considered patient in complete response when the electrophoresis, urine and serum was normalized. Though it's very important for my colleagues to understand that even when the electrophoresis in the serum and urine get normalized, there's still tons of disease, and that for a certain level, serum Freelite chain can catch that. So serum Freelite chain is an extraordinarily important test before you can say the patient is in complete response. The good thing with the serum Freelite chain, it's very reproducible. You can do 3 measurements in 5 minutes. You will get the same data, which is very important. In the urine, you could do 3 measurements in 5 minutes. It'll vary so much. But with the serum Freelite chain, it's a very reproducible test. That is very important. By incorporating the serum Freelite chain test in the guidelines, we have been now able to include those patients that were only measurable based on the serum Freelite chain test in clinical trials, and give a chance for those patients to have access to the new drugs and the most recent advances in disease because they were able to get into clinical trials and had never monitored disease. So it's also a very important benefit from using the serum Freelite chain test, definitely. We've been working with electrophoresis for like 20 or 30 years, and it's a very insensitive tool. And the discovery of the serum Freelite chain is one of the most important discovery in myeloma. If you look at the biology of the disease in a routine practice, serum Freelite chain has been one of the most amazing discovery in the last years that have been directly applicable for the real life, for the patients in the real life. It gives an enormous chance to the patients to get better monitored for the disease, and we know how important this is to control the disease and give more chance for those patients to survive.